This is a video explaining the standing soleus raises. This is an exercise that would be included in the strength phase of the rehabilitation program. It's often used in conjunction with regular variations of the calf raise targeting the gastrocnemius. This exercise mainly targets the soleus since the knees are bent and can be useful for calf strengthening as well as helping with eccentric control of the knee joint for runners. So for the exercise, you would instruct your patient to have their knees bent and essentially just do a calf raise. For this, you want to emphasize that they should be going up and down in the calf raise with slow and controlled motions so that the movement is intentional and it really targets those muscles. For the initial prescription, I would ask the patient to do 3 sets of 15 reps or something that is similarly fatiguing. To progress, I would decrease the sets and add some weight. So this is this video with the weights. You can have the patient just holding it in their hands like that and have them do the same motion, making sure that their knees are facing outwards and not going into a valgus position. And again, really emphasizing that up and down control of the calves. To regress, I would remove the weight and lower the sets. I would still want the patient to use a higher rep since this is an endurance muscle, which can only be targeted and strengthened if it is exposed to fatigue. Indications for progression is when the activity is no longer fatiguing. This is when you would increase the weight or sets. And you can have an athlete perform a single leg calf raise endurance test to gauge if the muscle is becoming more resistant to fatigue. This activity should be discontinued if the athlete is complaining of pain, and since it's not a very challenging or strenuous exercise, which requires very little time, but is important for endurance and stability, it can be continued long into the rehabilitation program.